Hey guys, this is Dr. Hub. Today we are going to look at the types, and this is going to be types of the tympanic membrane, TM, and we are just focusing on the perforations. So just to recap, the tympanic membrane, it is made up of, there are two perforations that are seen. One is the pars tensa perforation. The next one will be the pars flaccida. There is a pars flaccida perforation. Now, looking at the pars tensa, this pars tensa, there is a central perforation. There is something known as a central. Let's write it down. Central perforation. So the central perforation, it has various subheadings. That is, there is a small. So what is small? Small means it involves only one quadrant. So small means it involves one quadrant. So to better understand how is the tympanic membrane, we have already made a video on that. That is the structures of tympanic membrane. So to continue, we saw small, it involves one quadrant. Next comes medium. So what does medium do? Medium involves two quadrants. Then comes there is large. So what does large do? So large, we have three quadrants. Then comes subtotal. There is something known as the subtotal. So subtotal, it involves all four quadrants. So subtotal involves all the four quadrants. Minus, so all four quadrants, and excluding the annulus. So except the annulus, it includes everything. There, so other thing in pars tensa perforation, we saw the central perforation. Next comes the marginal perforation. Next is the marginal perforation. So in case of the marginal perforation, there is a posterior-superior. So there is PS, that is a posterior-superior. So in terms of posterior-superior, the part of the annulus is also lost. So the part of the annulus. So part of the annulus is also lost. Next is in terms of total. Next is in terms of total, it involves all four quadrants. So it involves all four quadrants, and this leads to, and as well as the annulus, so it involves all four quadrants plus the annulus. Next we move on to the pars flaccida perforation. So in terms of the pars flaccida perforation, so this pars flaccida perforation, it is also called the atticoantral disease. So there is a atticoantral disease. So here what happens is, there is attic perforation. So this is the pars flaccida, there is attic perforations. So this was all about the types of tympanic membrane perforations. So we already made a video on the tympanic membrane and we have explained the parts. So it is a continuation of that video. So we have seen the pars tensa perforation as well as the pars flaccida, and under pars tensa there was a central perforation and the marginal, and we are also seeing the pars flaccida perforation. To learn and grow daily like this, please do subscribe.